Robert Ball, who is General Counsel at Enlace Health, one of our sponsors, to come and open things up and to introduce you to our other sponsors. Robert?
All right. Thank you, Mike. Good to be here. Can everybody hear me all right? All right. Great to be here. As Mike said, I'm Chief Legal Officer at Enlace Health. We're based out of Atlanta and Columbus, Ohio, but glad to be here and glad to be sponsoring this again this year. Did so last year, and it's a great event. Nelson Mullins, I want to really give them a thumbs up and commend them. They put together a great program here today. I think one of the keys that I saw was the title of this conference is Implementing Value-Based Strategy. So over the past couple of years, I've seen this sort of evolve. So really today is about getting to it, setting it up, implementing it, operationalizing it. So it's not just, hey, value-based care is an interesting topic. This is how do we actually go do it, which I think is a huge step forward. I encourage you to stay through all the panel discussions today, mainly for two reasons. Again, they build on one another, sort of the strategy to the operationalization to working between specialty and primary care. So there are two reasons. One, it evolves, and number two is I'm on the last panel, and if you all leave, I'm going to kind of feel bad about that. So quickly, here's a teaser on what you're going to hear. We're going to lead off with Juliet Price from HSG, and I'm going to hold off. I'll tell you more about her in a minute when I introduce her. The first panel is on VBE, Value-Based Enterprise as a Strategy. So I think this is really key. I heard a very similar presentation back in June, and I can tell you how much it affected me is probably Monday morning in Enlace Health, we're launching our first value-based enterprise with the help of Ed and Mike and the Nelson Mullins team. So I encourage you to listen to it because I think it is strategic. It's strategic to us. It's not just a nice little legal, how do you set up a VBE? That's really nice. It is very strategic. The second panel is around operationalizing VBE. You know, how do you do this? And again, I've been around the sort of tech innovation world for quite a while, and I like to say I've seen a lot of new technology waves sort of crash on the beach of workflow. You know, it sounds good, but then when you get down to the lowest common denominator, somebody who has to change what they do every day or adopt a different policy, it crashes and burns. So how do you operationalize it? That's going to be key. The third is really what we all know and love as lawyers, navigating the compliance landscape. So a lot has been happening there. Again, one of the great parts about being in the value-based care space is it's opening up a lot of avenues. And then last but not least, I'll be on a panel talking about integrating specialty care and primary care. Most of the action has been in the primary care space when you see Oak Street get bought by CVS Aetna for $10 billion plus, then they turn around and spend another $8 billion on Signify Health, and Iora sells out to Amazon or to One Medical for almost $3 billion, and then turn around and they flip that to Amazon for $4 billion. So that's where a lot of the action is. And I come out of the specialty world. That's what we do. And you know, there's recent reports that that's where all the money is. So we're very excited about that part. So a couple housekeeping points real quick. Whether you're attending today in person or virtually, happy you're joining. The variety of panels, there'll be, if you will, kind of save your questions for the Q&A sessions at the end of the panels. If you're joining virtually, you can add questions to the chat box that's probably presented on the whatever the virtual hosting system is. And if you're here, or I'm sorry, if you're joining virtually and you want to receive CLE credit, somewhere during the day there'll be 2 keywords that will be given during the presentation that you'll need to remember. So now I'd like to just introduce really quickly our sponsors. Genuine Health, let's see, is Dave Salazar here?
Dave's not here, just me.
Okay, Mark, do you want to just say a word or two about Genuine Health?
Sure. I'll stand up so
You can come on up here. Come on.
Okay. So I'm the Chief Legal Officer with Genuine Health Group, and Genuine Health Group is a multifaceted organization. We're primarily involved in different aspects of managing both healthcare practices, facilities, and other types of providers. We have a basic ACO, an enhanced ACO. We own home health agencies. We had a DCE, which has been grandfathered into as an ACO REACH, and we started out primarily in the Medicare Advantage space. So we go across all the markets, have a lot of different experiences, both from a legal standpoint and from an operational and hands-on real-world issues standpoint. So look forward to being on one of the panels later and to meeting everyone here.
Sounds good. I'll take that. Darcy, do you want to say a word? Darcy Devine's with, do you like Buckhead FMV or just BFMV?
Oh, Buckhead FMV.
There you go.
Shout out to Atlanta there. Hi, I'm Darcy Devine with Buckhead FMV. Brianna Gordon back there, she's with me here today. We're a healthcare appraisal firm. So that means we value healthcare businesses, assets, and services. We do a lot of physician compensation work. I'm very glad to be here today because the time has come. Almost all our valuations right now have some kind of value-based component to them. They're either pure play value-based players, or they're there, they've got some component of it, or they're going there. And I'm going to listen today for some what the panel says about physician compensation in particular, because we do a lot of fair market value work, and we have a lot of physicians that are getting value-based components to their contracts. And we've got compliance issues there that we've got to think about. We want to make sure that the physicians are paid compliantly, but also got to pay them competitively and interest them in this value-based world. And how do you do both of those simultaneously? So I'm hoping the panel answers some of those questions, and looking forward to it.
Awesome.
Thanks.
Kelly Conroy, is Kelly here? Our third sponsor is Pinnacle Health. So Kelly, I know, is speaking on the panel later this afternoon. So when she gets here, we'll give her the chance to introduce and talk about Pinnacle Health. And last but certainly not least, I want to introduce Juliet Price, who's today's keynote speaker and the Group Chief Solutions Officer at HSG. Juliet advises a wide variety of clients, including providers and provider groups such as ACOs, IPAs, payers, startups, governmental agencies, social service providers. She's trained in the IHI's Breakthrough Improvement Model and routinely trains teams for the model for improvement. Her focus in healthcare is building value-based care models, both to reduce costs and improve outcomes. It's really, Juliet's a great speaker. I've had the honor of speaking on panels with her before, and if you're on a panel with Juliet, the great thing is if somebody asks a question that's really hard, you can just say, well, I'll let Juliet answer that. So she's a bit of an encyclopedia here. But her approach has really led her to be able to lead extremely complex negotiations and transactions. And so without further ado, I'll let you introduce HSG and then take it from there on the keynote.